And a very warm welcome to Telford and Wrekin Council Facebook live event. It's Friday the 17th of December and we're with you for the next hour to talk about everything you need to know about COVID, the vaccination and booster rollout, basically anything that you need answers to that we can help you with that will keep you safe over the next days, weeks, months ahead. So my name's Jan Jennings. I'm going to host the next hour and I've been joined by an excellent panel of experts and they are Shaun Davies, who is the leader of Telford and Wrekin Council, Liz Noakes, our Director of Public Health, Patricia Davies, Chief Executive of Shropshire Community Health NHS Trust, and Dr. Stefan Waldendorf, who is a local GP. Now, we have obviously promoted this event and we've got a number of questions that have come in already, which is great. And please do feel free to get in touch with us during the evening and we can take those questions on and ask our expert panel. Before we get into the questions that have been sent in, I just want to go directly to Shaun and just sort of reflect, Shaun, on the past few days, because it's less than a week since the Prime Minister came on TV and told us that they wanted to accelerate the vaccination and booster rollout. And certainly I'm very aware that in Telford and Wrekin we've been working very hard to accelerate what we're doing off the ground. So perhaps you can just give us an overview of what we've managed to achieve over the past few days.
Thank you, Jan. Well, the Telford and Wrekin Council, together with the whole health sector here in Telford and Wrekin, have worked really hard to ensure that vaccinations are available to our communities here in the borough. And of course, the same applies across Shropshire Council area too, but tonight specifically about the borough of Telford and Wrekin. What we want as a council is to ensure that the jabs go into the arms as many residents that want them. Whether that be on a walk-in basis, whether that be on an appointment basis. And tonight really is about answering questions that residents have been asking us as a council. There's lots of information in the media, there's lots of information online, but sometimes the ability to speak directly to experts, like as we've got tonight, as a panel tonight, is difficult. So please do ask the questions that you've got. We're here to give you objective answers. I know that there are people who have put forward some comments around vaccinations. My position is very, very clear. You will make an informed decision about whether or not you want the vaccine or not. And tonight is a part of that being informed. We're not going to get into the details or the debate around theories one way or the other. This is about an objective piece of information to help our residents make an informed choice.
Thanks very much indeed, Shaun. So I think we'll crack on with some of the questions that we've had submitted already. And Patricia, I'm going to come to you first of all. As I mentioned at the top, Patricia's Chief Executive of Shropshire Community Health NHS Trust. And we've got questions about young people. So I'm going to batch a couple together actually, Patricia. And they are, when can 12 to 15-year-olds get their second dose in the borough? And can I bring my 12-year-old along to a walk-in clinic?
So to answer the first one, yes, 12-year-olds can have a second dose, but it must be at the right time. So 91 days or 3 months after their first dose. So that's eligibility in terms of 12 to 15-year-olds in terms of second dose. And in terms of bringing your 12-year-old along to a walk-in centre, yes, you can bring your 12 along to a walk-in centre to be vaccinated.
Thanks very much, Patricia. And following on with vaccinations, question for you, Stefan, and no, you're there on the ground, you're a local GP, and a couple of specific questions about somebody asking, if I've already had COVID and I have antibodies, why do I need the vaccine? Or you need to turn your mute off, Steph.
Yep. The reason for that is a simple one, really. What we were dealing with before was COVID, the Alpha and the Delta variant, and I think everyone knows now that there's different variations of this virus. If you had COVID in the last few months or even longer ago, you're very likely that you had an infection with the Alpha variant or kind of earlier this year, the Delta. Unfortunately, it does not give you really the same protection for the Omicron variant, which is so highly in circulation at the moment. So from that point of view, you can get, if you had COVID Alpha, you can still get COVID Omicron or Delta. The other thing is that the immunity does wane over time. So if it's quite a while ago that you had an infection, your protection will gradually go down. And by repeating vaccinations, and hence we have a very acute booster campaign at the moment, you shift that protection with time forward. So if you have your booster now, it will give you protection for the next 3 to 6 months.
Thanks very much. And a follow-up question actually, which is, will walk-in services be available at GP clinics?
No. And the reason for that is that it's logistically very difficult to plan for us how to provide the service to our patients. So in GP surgeries, we are doing the vaccination parallel to our normal very high workload we have at the moment. So we have to kind of plan the time exactly when we can afford to have people step away from the clinical work and provide vaccinations. And also the logistical side to order the right amount of vaccines is very difficult as it is. If you have walk-in centers, we don't know how many people will come through the door, so we might run out of vaccines and people might get unhappy with that, or we order too much vaccine and we have not enough people coming and we have our vaccinators sitting around. It's not really the situation at the moment, but we try to have a little bit control, and by inviting our patients, we know exactly when patients will come. For the patients, it means that they do not have to wait in long queues out in the rain. Oh, it's not raining now. But it just makes it for everyone a little bit more plannable. And we know when patients come and we have enough vaccine available, we have enough stuff available at the time to provide a very swift and quick service.
Excellent. So that's a very clear answer. No walk-in to GPs, but there are other places available where people can walk in, and those are widely promoted.
Yeah.
Thanks so much, Liz. Liz Noakes, our Director of Public Health. A question for you now, which is about the supply of rapid flow tests. There's a question that's come in about where can I get rapid flow test kits, because lots of places do seem to be out of stock.
Okay, thank you. Can I just add to Patricia's answer around the 12 to 15-year-olds and walk-ins? And that's to say, do check the website for what is available at each walk-in. You need to check that the website says that walk-in does 12 and overs. That's because not all of them do. So do check the website. It's a good place for that information. So as far as LFDs are concerned, I think we all know that we should be taking an LFD twice a week. And particularly at this Christmas period, whilst I would urge people to be cautious about social events, if you are going out to a social event or visiting a loved one, a vulnerable person, I would equally take an LFD. There has been unprecedented demand recently, but I do understand we do have stocks within the council centres and pharmacies. I understand we're getting a delivery today. So our council centres that give out LFDs are at the Place and the libraries. The details are on the website, but I would urge people not to stockpile. We have had unprecedented demand and perhaps people are stockpiling. So we will only give out 2 boxes per person. We need to have enough to go around over this period. Keep an eye on our website for details as to where the LFDs are available. When the libraries close over the Christmas period, we will have availability in other centres. So that's worth watching the website for that.
Thanks, Liz. So that's where you can get them in Telford. And I think I'm right in saying, well, I know I'm right in saying actually, because I did manage to order some myself through the NHS app. And they were delivered, I think, within, well, it seemed like the next day. It was very speedy anyway. They came around quite quickly. But as you say, Liz, we've got them available at Telford and Wrekin venues, and you can find all that information on our dedicated web pages. Right, back to a question that's come in, and Shaun, I'm going to give this one over to you. We don't want to debate the vaccination too much, but we do know that people are anti the vaccination, and somebody has asked what information can they share with people who are anti-vax to put them at ease. Can you help with that one?
Well, I think it's about people having the ability to access information from a trusted source, isn't it? So at the moment, there's a huge amount of information available online. And what I would say to anybody on this issue is to ensure that they get a rounded view of what's being said. I've seen huge amounts of claims and counterclaims banded around, What I would say to you is, where would you go normally to access trusted health information? You would go to your GP or the NHS or a trusted media outlet. And this is no different. You should be able to do that. And one of the things I've been speaking to health partners and colleagues only today is the ability to be able to speak to somebody to ask questions about the vaccine. So I've spoken to people in my own community, for example, who are breastfeeding their babies who've got concerns about the vaccine. And that isn't to say that somebody is reading false information or is stupid. They simply have some concerns or questions. And you can now call a helpline on 01952 382 030 and start to talk through some of that information. And get that evidence-based so you can make an informed decision. And as I said right at the beginning of this evening, I'm not here or nobody's here to try and force people to take a vaccine, but equally people should not be putting false or fake information that they do not have the ability to reliably, scientifically and objectively prove.
Thanks very much, Shaun. Right, thanks for that helpline number. Just to repeat that, we have a council helpline number 01952 382 030. That's available at the weekend, Saturday and Sunday between 9 AM and 1 PM, and on weekdays 9 AM to 5 PM. That's 01952 382 030. Right. I'm going to a couple more questions about jabs actually, and Stefan, if I can give the next one to you. We've just mentioned it briefly already, but we've had the question come in, so we'll just ask it again about the gap between getting the jabs. Can you just talk us through what that gap is for different circumstances? I think it's been changed, hasn't it? The
yes.
Recommendations have been changed recently.
I think the government has not been the clearest in their communication about when you can book and get and what the gap is. So to make it quite clear, it used to be 6 months between your second vaccination and the booster. And we have to adhere to that very strictly. We really can't make any exceptions for that. However, the guidance was changed when we had the accelerated vaccination program. So now it is 3 months, and it needs to be exactly 3 months after your second vaccination you had. So most people who are in the age group of 18 to 49 at the moment had their vaccinations over the summer. So if you had your vaccination up to middle of September, then you're eligible now to have your booster. If it was after the middle of September, then it's too early and you can't have it yet. We are really kind of quite strict with that for various reasons. It's partly to make sure we make best use of the vaccine we have, because if it was shorter than that, you still have quite a lot of immunity ready to protect you, and also to manage the kind of stock we have. So at the moment, it's very clear it's 3 months. It says that you can book it at 2 months after, but it means the process of booking, not of getting the vaccination. And there has been a little bit of confusion about that. So although you might be able to book an appointment 2 months after your second vaccination, the guidelines are very clear. It needs to be 3 months after your last vaccine.
Thanks, Stefan. And you know, some people who are maybe a little bit disorganized, who can't quite remember when they had their vaccine or haven't got that card that you were given when you had your first and second vaccine, if people think that it's sort of around the right time and they sort of give their basic information over, will they be able to find out? Will people be able to help tell them when their next vaccination is due?
Yes, our system will allow us to find out for them when they had the second vaccination. It's on the GP's computer systems, and it's also on the vaccine center software. So when you turn up there and it was less than 3 months, they will be able to tell you. However, there's 2 systems out there anyway. So partly patients are invited by their GPs directly. So you get a text message from your surgery asking you to book an appointment. If you do get the text message, we pre-filter that. So we only invite people who are eligible for the vaccination. The other option is the national booking line to book an appointment. So that is when you ring 119 or go online. That usually will advise you as well when your last vaccination has been.
Brilliant. Thanks very much. And actually, I've got another question now for you, Patricia, about the vaccine, which is, someone's asked, which vaccine do you get for the booster?
So you get either Pfizer or Moderna, and you don't have a choice in terms of that. It's whatever available at the vaccination centre. Both have the same efficacy, so they both have the same impact in terms of coverage and protection. So it's either Pfizer or Moderna.
And people don't need to well, people don't have a choice, and they don't need to be concerned if they had a different vaccination for the first or second dose.
Not at all. So, for example, my husband had AstraZeneca for his 2 jabs, and recently he's just had his booster, and that was Pfizer, and that's absolutely fine. And science, there's good science behind that. But yeah, you could have a Pfizer or you could have Moderna. Both are equally as effective in terms of giving you that protection.
Brilliant, thank you. Okay, Liz, I'm going to come over to you now. We've got a couple more slightly complicated questions actually as they've come in, but let's give it a go. So here's a question about, if you've had COVID, you shouldn't take an LFT or a PCR test within 90 days. How then do you produce proof to get into any social events when needed? Because I think we're hearing that a lot more now, aren't we, about people needing that proof. But obviously, if you've had COVID, you're not able to take the test. How can people go about proving that they're okay to access these events?
So first of all, it is true that if you've had COVID, you shouldn't take a PCR test within 90 days. But it is okay to take an LFT test, which is a different test, and which is actually testing for your current infectiousness, so to speak. And so you can take an LFD. And in terms of going into either nightclubs or certain events of certain sizes, you need to have a proof of a recent PCR or LFD, as we've just described, or indeed a proof of a double vaccination. So you can take an LFT even if you have tested positive in the last 3 months.
Okay. Thank you. And another question for you is, if I might, which is, why is it okay to be unvaccinated, untested before 1 o'clock in the morning, but at 1 o'clock you then need to provide proof of these things, even though if you've been in the same pub, club or event all night with the same people? What's that difference between before 1 a.m. and after 1 a.m.?
Well, I think you've given me the tricky one there, Jan.
Okay.
I think what I would say is it does appear odd. I know this is about applying the government rules. So in terms of the COVID passes, which is either recent PCR or LFD or proof of double vaccination, you will need to have that if you go into a nightclub, disco or dance, or indeed if certain events with different criteria, or if your pub or venue has late night opening, i.e. after 1 o'clock in the morning. It's just the way the rules are, so that we need to follow those rules. If you have any queries, council happy to answer those queries at coronavirus@telford.gov.uk, and there's an email address that our environmental health officers will be able to respond to.
Okay, thank you very much. Anybody who's got any questions they want to put through to our panel, please do get in touch. We're here for a little bit longer yet. We've got plenty coming through, and the next one I'm going to ask you to answer, Shaun, if that's okay. If the immunity of the first 2 vaccinations is waning or has waned, and therefore people need boosters, why are double vaccinated people able to freely access all when they may well have less immunity than, say, someone who's unvaccinated, who's recently had COVID and has got natural immunity?
So I'm sure the experts will want to pick up the medical element of this question in a moment or two, but for me there's 2 answers to this. The first one is that clearly once everyone's had an opportunity to get their booster, no doubt that the rules will change to redefine what fully vaccinated means to 2 doses plus a booster. And I think that will happen as a public policy thing once everyone's got an opportunity to get the booster, because it would be unfair, clearly, if that rule was to come in at this point in time when everyone's rushing to get their booster. The second thing I would say around this is that just because you are double dosed, or indeed you've had your booster, doesn't mean that you should not be tested twice a week in any event. And it doesn't also certainly doesn't mean that you shouldn't be doing hands, face, space, and fresh air, because we do know that the information that's coming through at the moment, it's early days, but somebody who's got a booster is around 75% protected from infection. That means, therefore, by definition, that there will be people who do get infected even if they've had the booster. So it's really important we continue to get tested twice a week, regardless of our vaccination status, and we continue to exercise hands, face, space, and air. But I'll maybe Jan, you'll ask the experts of the panel around the particular around the immunity question, because I'm not a clinician.
Thanks, Shaun. Stefan, do you want to come in on that?
Yeah, I can try to answer that. It's a little bit politics, obviously, and we know that it's a bit about practicality, because you can't really prove, or you can prove whether someone had an infection and has got enough antibodies, but we don't do those tests. So we can't really easily provide a test to say that you had COVID and you have antibodies, so you should be protected. So practically, we can't prove that. When you had 2 vaccinations, and certainly when you had a booster, the risk of transmission does go down considerably. It is never zero. Kind of medicine never has zero. It's all about probabilities. But if you had your vaccinations, the transmission probability goes down significantly. When you had a COVID infection, you have obviously immunity for a while again, and you will have a little bit of less risk of transmitting it to other people as well. But to prove that, to get into a venue or something like that, is just not possible. So from that point of view, I fully agree with Shaun. Says we are still getting tested. I had all my 3 vaccinations, and I still do a lateral flow test twice a week to make sure I'm fine. Or whenever I go into a particularly sensitive area, like in a care home or things like that, we always still do LFTs, and we all have triple boosters, triple vaccinations. So it still is a kind of risk, and it's a smaller risk, but transmission is still possible. So we need to act in regard to that.
Thank you. Patricia, anything you want to add? Or has Stefan sort of covered that area?
Yeah, pretty much. I think Shaun, very well done, actually. I think we might sign you up for a few shifts. That's really good on the science. Having 2 vaccines protects you from COVID-19. As Stefan said earlier on, the booster helps to boost that immunity, but also it gives you the best protection to the new variant. And that's why it's so important. So having 2 jabs and having an infection doesn't give you the same immune response and same protection as a booster, which is why we're saying, please get vaccinated and have your 2 doses, and please get boosted when you need to have your booster, which is 91 days after your 2nd dose.
Thanks, Patricia. Just got another question in actually about the booster. I'll take it now, which is, will having the vaccine/booster give me a positive LFT result?
In short, no.
Okay, that's very clear. Thank you. Shaun, question for you. If the vaccine makes me so sick and I can't work, will I get sick pay?
So this will come down simply to your terms of conditions of employment. So some employers will take a view on that, and others will not. So what I would do is really look at your contract of employment and speak to your employer, and if you are a member of a union, then discuss it with them too. And hopefully what I'd encourage all good, decent employers is there's a pragmatic and supporting view taken into such things. I had my booster last Sunday, and I was a little bit ill on Tuesday and wasn't able to go to work, and I would hope and expect good employers to be pragmatic about that.
Yeah. I had my booster and I couldn't quite put my finger on how I felt the next day, but I just didn't feel great. I was at work, it was fine, but I couldn't quite just say, I just didn't feel like I was as sharp as I might have been. But that was all. I think we are hearing that different people are impacted in different ways. So it's a fair question. I think Shaun's advice is pragmatic. Talk to your employer. Another one for you, Shaun, if I can. Questions come in. If you can still catch and pass on COVID as a double vaccinated person, are they not potentially spreading COVID more as they don't have to provide a recent LFT compared to an unvaccinated person who does?
So again, it goes back to that point that just because you're double vaccinated doesn't mean you shouldn't be testing yourself. So it's not in isolation. The double vaccination, even if you're boosted, is not a guarantee that you will not get the infection and then be infectious. And we know, don't we? I think it's a well-known stat now that roughly 1 in 3, maybe a little bit more, of people are infectious without even knowing that they've got the virus because they're not showing any symptoms. So it goes back to that point again that the booster and the vaccines are amazing in many, many, many ways, but it doesn't negate for the reason, for the cause, or for the need, sorry, to get tested regularly. So it's not either or, you should be doing both.
Thanks, Shaun. Right, we've got lots of questions coming in. I'm going to go to you, Stefan, with the next, well, 2, I think, actually, which is the first one. If you're 18 and your booster is due on the 25th of December, Christmas Day, can you have it earlier? And the second one is, if you're immune suppressant, will you need a 4th booster jab?
Okay, so the first one is simple. Unfortunately, not.
Oh, really?
If your birthday is if your booster is due on the 25th, unless you find a place which is open on the 25th, but I don't think there will be any, I think you need to wait till after Christmas. I don't think it's time critical by day. As much as we like everyone to get boosters, as Boris said, I do think one day will not really make much of a difference there. So we technically can't give anyone a vaccination below 3 months. The software does have a check-in there and will not allow us to record.
Right. Okay.
The question about immune suppressed patients is much more interesting, because there's a lot of confusion about that, because patients on immune suppressants had a third vaccination, and they still need a booster after that. So you had the third vaccination counts as a third vaccination, not as a booster. So they will need to have a booster after 2 or 3 months after they had the third one.
Thank you. Thanks, Stefan. Right, here's an interesting question. I'm going to, I suspect, Liz, you may be best to help with this one, but again, if anybody can help, shout out. So it's a question somebody has written in to say, I had to help someone who found themselves homeless, but had to prove themselves as an EU national. Otherwise, he would have had to go back onto the street. Is there anything to help EU nationals not be on the street and so vulnerable?
Should I pick that up? Maybe. So clearly anybody on the streets of Telford and Wrekin we want to know about, and you can report in order for us to be able to support by contacting the council. And you can do that on 381 818, and you can report so that we can support. We've got a really generous offer here in Telford and Wrekin that we will guarantee anybody the offer of a bed here in Telford and Wrekin, particularly in the winter months, but certainly throughout the year too. Now, clearly, those people have to be from Telford and Wrekin, and they have to resonate from Telford and Wrekin. But even if they don't resonate from Telford and Wrekin, we'll then put them in contact with their local authority. But we've got a huge amount of support. There's no reason for anybody to be sleeping on the streets of Telford and Wrekin. Thankfully, our rough sleeping, our street sleeping numbers are very, very low compared to other areas of the country, but we absolutely want to help. So please do contact the council. Let us know where you've seen somebody sleep streeting, and we will send out outreach workers so that we can support them.
Thanks for picking that up, Shaun. Liz, a statistical question here for you, which is, do we know how many people in our hospitals have COVID? And do you know how many of these are unvaccinated?
So I've just saw that coming in and looked up on the dashboard as we speak, and we've got 24 patients with COVID in the hospital at the moment. That's in Telford and Shrewsbury sites. In terms of how many are unvaccinated, I don't have that at my fingertips, but what we would say, and what the hospital continues to say, is the sickest patients are those that have not been vaccinated. So it is really, really important at this time that even if you haven't had a first dose, get your first dose. If you haven't had your second dose, follow through, and then for many of us now, get that booster.
Okay. Do we know the sort of percentages of people who are vaccinated in Telford and Wrekin? How do our figures compare to other areas?
So our vaccination rates have been good compared to other areas in the country. We do have our figures, and in terms of the numbers that we still yet have to immunise for the third dose, we're at just over 44,500 patients or people eligible for their third dose, and that's the target that we're trying to achieve. But similarly, we have probably got about 32,000 12-year-olds and above who haven't had their first dose. So again, that's a really important number to try and reduce.
Yeah, okay, thanks very much. Liz, I'll stick with you if that's okay. We've had a question in about, do you need a code first before you collect an LFT? Somebody said they were refused at the chemist as they didn't have a code.
I think you do, but in our council sites, which are the libraries and the place, you don't. You can just go in and pick the test kits up. But as I say, I'm only giving out 2 at a time.
Yeah, okay, that's fine. Thank you very much. Are we extending those pickup places over the sort of Christmas break?
In terms of the libraries are closing between Christmas and New Year, so some of our leisure centres that will be open will take their place.
Fine, and we'll have more information.
Details on the website. Yeah,
on the website, always on the website. Okay, thank you. Stefan or Patricia, I don't know if you can help me with this one, but we've had a question to say, is it correct that the vaccine contains graphene?
It's not. It's one of this kind of, they call it fake news nowadays. There was some researcher in Spain, some professor who made that statement after analyzing one vial he had received. However, it was not reproduced by anyone else. And when it came under more scrutiny, they found he could not explain where he get his vial from. So it was not an official vial he had tested. Right. It's about graphene oxide, but it's in any of the vaccines contains that at all.
Okay, thanks for clearing that up. Patricia, another question coming. I'm going to direct this one to you, if that's okay. If the unvaccinated can't take an LFT or a PCR within 90 days of having COVID, how do they get a COVID pass?
So I think we might have answered this one earlier. It was a very similar question, and Liz beautifully answered that. So it's the PCR test that you can't take within 90 days of an infection, but you can take a lateral flow test and use that. And obviously, as a negative, if you have a negative test, then that is applicable. So yeah, same answer.
Thank you. And apologies to people that are watching if we think we're answering the same questions again. Obviously, we're getting people joining us all the time. We want to try and make sure that we reflect those questions that are coming in. So thank you for continuing to put all these questions in. We've got many more to get through. The next one is about why we're vaccinating youngsters from 12 plus against the advice of JCVI and only recommended by Chris Whitty as part of keeping the schools open. They're saying this is the first group that are not following the science. Not quite sure who to come to on that. Liz, do you want to pick it up?
So shall I start? And I'm sure Liz will come in with the public health advice. I think let's just be clear. JCVI were asked a question about whether it was applicable to give on medical grounds, and on pure medical grounds, their view was on balance, younger people tend either not to get infected as much, and if they do, the disease tends to be very mild. However, one has to think about that in the context of children in society, children needing to go to school, children that can also be transmitters of the disease. And so when you consider that in the whole round, not just Chris Whitty, but all of the chief medical officers for the 4 nations agreed that when you look at the wider public health issue, it was in the best interest to vaccinate. And I think, personally, as a healthcare provider, as a clinician myself, I think that was the right thing to do. The consequences of children not being within society in terms of their education, in terms of their mental health, has profound consequences. So I think one has to take the chief medical officers collectively took that decision based on the wider determinants of health and the impact that the infection has.
Thanks, Patricia. Liz, do you want to add anything into that?
No, very well said, Patricia. Make a public health person out of you yet.
Okie doke. Thank you. Shaun, I'm going to come to you about this one. It's a question about volunteering, and somebody's written in to say, for those of us who've registered to become volunteers to assist with the booster push, how do we get the required training to give vaccinations? I've been accepted, but I haven't been contacted with any details yet, and I really want to help with this if I can.
Well, firstly, can I say a huge thank you to all the volunteers who have helped, not just on the vaccination front actually, but across the whole pandemic response across Telford and Wrekin. It's been absolutely phenomenal to see. So thank you so much. And it's brilliant to see people still stepping forward, stepping up, wanting to help their community. It's really, really heartening to see. So there might be a question for our health colleagues again around how the NHS is processing those volunteer requests. There's a number of ways in which people are volunteering. So firstly, if you contacted the NHS or a national scheme to volunteer, they will be back in touch with you very, very quickly. Clearly, they are working through a number of people expressing support, and I know that they are working through that urgently so that they can bring forward volunteers. Separately to that, the council have also got a number of volunteering opportunities, for example, marshalling and other things linked to the vaccine centres and also the COVID response. And if you haven't heard from us having made an application, then you can email me at Shaun, SHAUN.Davies, DAVIES, at telford.gov.uk, and I'll put you in touch with the team who is handling the volunteering opportunities. Just to let you know that the peak of the pandemic prior to this phase of it, we were having over 1,000 people coming forwards wanting to volunteer, and that's a really good problem to have. That we want to go through that, and we don't want to not encourage people to come through. But I know our NHS colleagues are also working through a big call of people responding. But you're absolutely right to be impatient. You want to start helping, and if you wanted to, again, to contact me individually about your own application, I can put you in touch with the relevant people.
Thank you. But yeah, we certainly have had a good response to the shout out for getting people to get involved, and I think it's tribute to everybody that we've managed to get this vaccination centre up and running so quickly, and hopefully it will get busier and busier over the next few days, and particularly now the schools are broken up. So thank you for that. Thank you for everybody for getting in touch. Don't know if we know the answer to this question, but Stefan, I'm going to come to you and try anyway, which is, do we know how old was the person who got Omicron and sadly died? I think it was announced over the past couple of days that we'd had first death from Omicron virus.
That's right, but we don't. It was just announced that there is a person who died, but we don't have any details about the patient.
No. I'm sure that will come out. Yes, sorry, Liz.
Sorry, neither do I know the details of the specific patient, but I just wanted to touch upon Omicron and our figures within the borough. So, as we all know, Omicron is sweeping the country. The West Midlands and Yorkshire are slightly behind the curve, but sort of hot off the press. So, as of the beginning of this week, I felt that about 3% of our cases were Omicron. As of yesterday, 33%, 34% Omicron, using a proxy measure for Omicron, which is S gene target failures. So in a sense, what I would be signalling to everybody is the uptick is now starting within Telford and Wrekin. Delta circulated within our borough at very high rates. So once Omicron comes, it's going to circulate again very rapidly. And so again, I would urge everybody who is eligible to get their booster now. We aren't going to be, January is going to be a very difficult month in terms of infection rates.
Thank you. Thanks, Liz. Still got more questions coming in. Patricia, I'm going to come to this one for you, please. It's about the questioner asks, if the vaccinated and non-vaccinated can both catch and spread the virus, what's the point in vaccinating at all?
I think the statistics around protection of life is clear out there. It does reduce mortality, and if you look at the statistics around hospitalisation and, more importantly, rate of death since the vaccination program's come in, you can see that has had a phenomenal effect. So it's absolutely worth it. Vaccination saves lives. Full stop. So that's the reason why. As Stefan said in one of the earlier questions, there is evidence that if you are fully vaccinated and indeed boosted, that there is a reduction in transmissibility, but you can still transmit. So you do need to still follow guidance around hands, face and space. But pretty much the vaccine is about saving lives and reducing severe disease and illness in people following the contraction of COVID, and that's why it's so important.
Thank you.
Stefan, I think, wants to add.
Yeah, I think this is a very, very important point, and that's a point which sometimes has caused a lot of confusion. Yeah. What the vaccine does, it protects you from getting severe illness. It does not necessarily stop you from getting the illness, but it stops you from getting severely ill. And you can see that in this wonderful graphs we get every time on our television screens in the BBC News. You can see the first peak when we had a high number of cases and a high number of people in hospitals and dying, compared to now where we kind of come into similar or higher territory of patients who have positive tests, but the hospital numbers remain low. And that is the evidence where the vaccination really shows that it's working. It does not stop you from getting the illness, maybe. It doesn't do that, but it prevents you from getting severely ill. Yeah. So all these people on the respiratory wards we had in the kind of beginning of this year with the horrendous pictures of completely overstretched NHS, where we really had colleagues of mine in the hospital who really were at the end of their tether. That has been prevented by the vaccination program we had earlier this year. So I do think it's very important for people to understand the vaccine does work, and it protects you from people dying, and it protects from serious disease. It doesn't stop 100% transmission, we know that, but it doesn't matter, because even if people catch it, they don't get severely ill anymore. And that is a key point of vaccination. So it's very important to understand that.
Thanks, Stefan. And I'd like to stick with you, if I may, Stefan. I've had another question come in about if you had your booster in the summer, would you need another one when you're immune suppressant, or would you still be covered by the summer booster?
So the summer booster probably wasn't the booster, but the third vaccine. It's a bit kind of question of how you call the thing. And that has a little bit caused confusion, particularly with this compromised patients. So they had an extra vaccination because we know that the kind of conditions or medications they have cause their immune system to not work very well. So they had a third vaccination, but it's not a booster. So patients who had the third vaccination in the summer still are eligible and should come forward to have their booster now, yes.
The booster, yeah. I think there has been a bit of confusion, hasn't there, about people who have needed to have that third vaccination and sort of how that fits into the sort of pattern of vaccinations.
It has been confusing, and in communication not always has been clear, because some people called it booster because it was a third one. But to make it very clear, for those patients, there has been a third vaccination, and they will still need to get the boost on top of that.
Okay, thank you. You know, Stefan, I'm going to stick with you again for the next one. So I think it's a question about when you get a booster, and I think this would be at a walk-in as opposed to a GP clinic. But when I go for my booster, am I ensured my jab will be given by a nurse or a medical person, not a volunteer who's trained up?
That is an interesting question. because it really depends where you go for your jab. So in GP surgeries, we work on a different system. So we usually work that we do have healthcare professionals who deliver that, so nurses or healthcare assistants, whereas bigger centers have sometimes a different system it's called the national protocol. So you have a healthcare professional who is there to ask you the questions, or if there's any queries, we'll be able to answer that. But quite often the vaccinators themselves are people who have volunteered, who had some basic training, and they will provide the kind of vaccination itself, but they won't be able to have the kind of clinical background to answer questions. So they, to make it able to scale up, they have this national protocol system where you have healthcare clinicians who answer questions, but specially trained volunteers who provide the vaccinations themselves.
Thank you. Thank you. Right, here's one, Shaun, I'm going to put it to you. It's about the vaccination of children, actually, and do you support vaccinating children? I know our medical colleagues may also want to have some input into that, but the questions come in. Do you support vaccinating children?
Sorry, John, who's that to?
Well, I was going to ask you to start with.
Yes.
Thank you. Anybody, Patricia, do you want to add to that?
Completely, absolutely. Absolutely support the vaccination of children.
Right. I think we're going to get a full house on that. So I think the panel all support that. A question about figures now, Liz, and I'm going to come to you because I think you have the latest details on this, which is how many people in total in Telford have tested positive for COVID of any variant since the start of the pandemic, and you sort of touched on this earlier, but someone's asking about the percentage of the population of Telford who are still unaffected.
So that specific statistic isn't on my dashboard. If you go on the national dashboard, there is a cumulative percentage of people that have had COVID once since the start of the pandemic. But as Stefan has described, you can get COVID a number of times, so in different variants. So there is that statistic. It's on the government website and it is by local authority, but I haven't got it to hand at the moment.
Okay. And back to the people that are in hospital, are you aware of the age group of the people that are in hospital at the moment?
Yes, in a sense, it is a range of age groups is probably what I would say. So, you know, over 40s and above, certainly. So we do monitor that. And as I said before, the sickest people in hospital are those that haven't been vaccinated.
Thank you.
I think Stefan wanted to come in there.
Stefan,
yeah, the age group is an interesting one, really. I just, for my own surgery, I had 2 patients in the last week who were just in the very low 40s, who were both in hospital for prolonged stays, which both of them had quite severe respiratory symptoms. Both of them came out and they're fine now, fortunately. But it is it demonstrates that these people can get ill, and both of them were unvaccinated. So it is a little wake-up call for us. These people do exist there in the community, and both of these patients were usually very fit young men who were severely ill for 10 days in hospital and the other for 12 days.
Thank you. Thanks, Stefan. Shaun?
I think it's also right to say at this point, and I'm sure and I hope that the panel will agree with me, that the new variant, there's so much that's unknown about it. There is no evidence one way or the other at the moment to say whether it's more severe or less severe. There's a lot of people think that are making factual statements in the absolutes around that question. At the moment, that hasn't been proven, so we don't know how it will affect people with underlying health conditions or by age at the moment, do we? I think the panel hopefully will agree with that.
Yeah, it's early days, very early days, isn't it? We've got One more question that's come in, and then I'm going to go around the panel for any sort of final comments, anything they want to say that we've not said yet, anything that key messages you want to get out. So, but before that, I'm going to come to Liz with this one, which is about the support for people's mental health. We know people have been very much affected by the pandemic, and of course we're almost 2 years in. Lots of people are feeling very lonely, isolated, and very vulnerable. What services are on the ground for people who are struggling with their mental health?
Well, certainly we all recognise the pandemic has affected people's mental health. You know, low-level mental health and more serious mental health. In a sense, it's such a broad question. It's very difficult to answer specifically. I don't know whether either Patricia or Stefan would have a better way of answering what is available on the ground. But there's certainly been much work done within the mental health services and within the council in terms of trying to boost some of these services. But I'd pass on to Patricia and Stefan perhaps on that one.
Yeah, I mean, there are a number of obviously official services going through mental health services and so on, but there are also other ways of connecting people. I think this is it's an anxiety-provoking time. So, you know, so linking up with voluntary sector organisations, the sort of IAPT services, the talking services, but also making sure that you're keeping contact socially with people in different ways. I know this is, you know, we're trying to tell everybody to curtail their social contacts a little bit at the moment, but there are different ways of doing that. Getting out and about, making sure that you've got some structure to your day, taking a sort of regular exercise, and talking to health professionals and not bottling it up. If you really finding it difficult to cope, come forward. There's nothing worse than feeling completely isolated. So it's coming forward to the mental health services, approaching your council, talking to your friends, talking to various community groups who are all there to provide support.
Thanks. I'll come to Stefan and back to you, Liz. I mean, Stefan, we hear an awful lot, don't we, about long waiting lists for mental health support. What's your perception on that?
It is unfortunately. I mean, particularly, the problem is kind of it's supply and demand. There is some services that are available for patients like that, like IAPT, which is a kind of talking therapies, but the workload they have received is very high, so it has led to some waiting times. There is a few alternatives there. We have at GP surgeries quite often people called social prescribers who are able to help with minor mental health problems. They can just provide a little bit of support and they can signpost to services available. And the other help in that for elderly people is we have what's called a care coordinator. So that is people who are specialized in knowing what support is available for the elderly people if you suffer with loneliness, with isolation. All of this obviously is made worse by the pandemic because you can't be visited and you might be just afraid about the risk of catching it by people coming to the house. So there is some support available through your GP surgeries, and I would agree if you have any concerns, if you feel that you do suffer, do come forward and contact us. I know we are very busy at the moment, but if there is a need, then there is someone there to help out and at least signpost you to a place where you can get help.
Thank you, Stefan. And briefly back to you, Liz. I've got one more question to squeeze in, actually. It's come in late. I'm going to take it.
Thank you, Patricia and Stefan. But I just wanted to make a plug that in Telford and Wrekin, we've got a Year of Wellbeing email campaign, 12 weeks of emails that are lots of tips and advice, very practical about looking after your well-being, particularly your mental well-being. I've personally signed up to it and found the emails really helpful, came on a Sunday afternoon, in terms of how to look after yourself mentally, and gave us some really practical advice. So please sign up for that Year of Wellbeing campaign.
Yeah, I've signed up for it too, and it's excellent, really, really good. Right, I'm going to take this last question, and then I'm going to do a very, very quick roundup with each of you. It's going to be very quick for you. But This one for you, Shaun. Somebody from a business has got in touch to say a lot of businesses are once again losing customers or they're having to close. They need help, particularly at this time. They felt they were excluded last time round, and asking the question, is there any financial help out there for them?
So the simple, most straightforward answer at the moment is no, there isn't. However, lots of people, myself included, are lobbying the government for support. Unlike last time, hospitality and other businesses have not been forced to close. However, everybody knows that people are making choices not to go out as much as they were before, and making choices around cancelling hospitality in particular, but other sectors being hit. So councils up and down the country and some members of parliament are putting pressure and lobbying the government to come forward with support around that. Once and if business grants become available, or furlough becomes available, or specific sector support becomes available, this council will move quickly to get that money into the bank accounts of local eligible businesses. We were one of the best performing councils in the country earlier on in the pandemic, and we would absolutely want to be one of the best performing councils this time round with any new grants that come forward. But at the moment, that isn't in place. But I think only time, I think time will change that if people are lobbying hard. So I would encourage you to contact your local member of parliament and make your views known, so those views can be passed on to the Chancellor of the Exchequer.
Thanks, Shaun. Right, we literally have a couple of minutes left, so I'm going to go around the panel, starting with you, Liz. Anything that you want to say just before we say goodnight for the evening?
I think just to say that the Omicron variant is a concern. As I described, that the uptick is starting to happen in Telford and Wrekin. It is really important. I would urge people to get their booster jab if they're eligible, or to get their first or second dose if that's what's due. It is really the NHS and working with the council are making it as easy as possible to get a jab. Telford International Centre is open this weekend, and Southwater Library equally is open for jabs on Saturday. So please get yourself jabbed.
Thank you. Patricia?
Yeah, I completely agree with Liz. The best Christmas present you can give yourself and to your loved ones is to get protected, so that you can live in an independent life and get on with life. It's the only way that we're going to be able to get back to normal as quickly as possible. So I would implore everybody to get vaccinated. And if you're still concerned and have questions, we're here to listen and talk to you through those, so that you can make, as Shaun said, an informed decision. And another plea as well in terms of vaccination, not just in terms of the coronavirus and the booster, but also flu. Flu is really important. Yeah. Getting flu and coronavirus is not a good mix. So please do get yourself jabbed.
Thanks, Patricia. Stefan, I'm guessing you're going to say the same message.
No, I don't.
Okay.
I don't want to repeat the same thing, because I think it's a kind of obvious thing. I would like to take the opportunity really to look a little bit back at the last year, and Telford and Wrekin and Shropshire has been able to provide 1 million vaccinations in the last year, which is amazing. And in this context, I would like to thank for all the people who have supported us. This would not have been possible without a kind of army of volunteers, from the marshals in our car parks, from the people who just help within the buildings, to the people who have been able to step up and come in as volunteers and work week in, week out. We have been vaccinating every weekend since October, and we have the same volunteers who come forward and help out, being it retired nurses or other healthcare professionals. So a huge thank you for all those people who have made this all possible. Otherwise, we alone couldn't have done it. And get boosted, obviously.
Thank you, Stefan. Do you know, it has brought out the best in people, hasn't it? It's been the worst of times, but also we've seen some great community spirit. And Shaun, I'll leave the final word to you.
Thanks, Shaun. Well, firstly, before we end the evening, thank you very much for all on the panel for giving up their Friday evening to answer some of our residents' questions. At the beginning of this pandemic, we made a very clear commitment as a council to the community that we serve, and that was to be by their side every step of the way during this pandemic. And we renew that, and I renew that pledge today. We will support people every step of the way. These are uncertain times, but what we will do is ensure that services are there for you. Vaccinations are available to you in the most easiest possible way. They are close to you. You've heard earlier on that we'll be taking a vaccine booster bus around Telford and Wrekin. So literally they will be on your doorstep to get boosted if you choose to. And it's still not too late to get your first or second jab if you've not already done that. But also just a plea to all of us as a community, because we are a fantastic community here in Telford and Wrekin, and that is to be kind, look after one another, look after yourself, look out for each other. Maybe have a think about how we all felt at the beginning of the pandemic. Things have moved on, but maybe going back to the basics, just checking on that neighbour across the road to see whether or not they need anything. Is there an elderly person in your street that might not want to go to the supermarket because they're fearful of the virus? Could you help them? Have a think about the businesses and services in your community that might be impacted as a result of some of the changes that are taking place. Can you support them in different ways? Let's get back to how we were right at the beginning of the pandemic. Team Telford and Wrekin, looking out for one another and being kind and being safe. Thank you.
Thanks, Shaun. Well, that's it. We've used up our hour of loads of questions, loads of interactions. Thank you to everybody who got in touch, and we hope we've answered the questions that you asked. Remember that we do have more information on our website and on partners' websites. We'll also be continuing to put out information over our social media channels. Thanks to the panel. Thank you, Patricia, Stefan, Liz and Shaun, and thank you to those people behind the scenes who have helped make this happen as well, and have helped us out throughout the evening. I think all that remains for us to say on behalf of everyone is to wish you all a happy Christmas and a happy and a healthy 2022, and good night.
Good night.